Hey, I'm Sarah Tegander, international speaker and trainer for a $40 million division in healthcare. With over a decade of experience working with healthcare providers, I believe that a healthcare practice should do more than just pay back student loans. Each week, I'll bring you the tips, tricks, and experts you need to build your practice both on and offline. Smart people take notes, so grab a pen or open up the Notes app on your phone as we dive into the Health of Your Business podcast. Today, I have one of the smartest people I've met on the podcast today, but it's not about to wow you with his smarts. That's not what this is about. It's about you, actually. I brought this individual in to be able to talk to you about a possibility of something that you could add to one of your existing health programs. I brought this individual on to give you an idea of how you could use this one vendor to create a massive health program around it. Wait till you hear about the potential of what some of their strategic partners have done. Now, this individual, he is the co-founder of the DNA company, where he established a ISO-7 GMP-compliant nutraceutical compounding facility. He serves as the director of product development. He oversees the entire lifestyle of the company that he's going to talk about today, the DNA company, their whole suite of products and services. His name's Haris Khan. He holds a Bachelor of Science in Honours Biomedical Sciences from the University of Waterloo. And after his undergraduate studies, he pursued postgraduate studies in Pharmaceutical Research and Development. Said maybe he was going to go into become some kind of doctor or physician, but decided to go a different route. Decided then to go ahead and work for one of Canada's largest generic pharmaceutical companies in the Formulations Development department. He was a key member of that team, and then went to go and co-found his own company, Youtrients, which now is the DNA company. I came across the DNA company at a conference, and if you've been following me for a while, that I've worked with other nutrigenomic vendors before, and nutrigenomic in this realm today seems to be a bit of a moving target, but I really like the leadership of the DNA company. I like what they have to offer. I have really liked to get to know both Haris Khan and Kashif Khan in what they're doing. I really believe in this mission, and I would be happy to make a warm introduction. I mean, otherwise you can go ahead and follow the links in the show notes to hear a little bit more about the DNA company. But I really want you to dive into some of the questions, whether you're new to nutrigenomics or you're advanced in nutrigenomics. This is really going to get you thinking about how to add things to your program that I know that you're building, right? It's the beginning of the year. Please start thinking about programs that you can offer to be able to create a little bit of leverage for yourself, even if it's a one-to-one program. When you have that kind of framework, you have that curriculum, you then can go ahead and leverage your time. You know exactly where your patients are in their patient journey. You're able to bring in seamlessly other health coaches or providers to be able to help you. And this is something that you can easily parlay into a group program or certify other providers in your methodology. So these are all things I want you to think about. I want you to think about the vendors that you might want to work with, and maybe the DNA company is one of them. All right, let's dive right in. Hey, Haris, thanks so much for hanging out. I know we are one of the few people that from the podcast I got to meet in real life, which is wild. Sometimes I meet people on the podcast and then get to meet them in real life. You were the opposite. And I went to a conference and went right up to your booth and said, nutrigenomics, we need to talk. I am looking for a nutrigenomics vendor. So thanks for being my current vendor of choice.
Thanks for having me, Sarah. Appreciate it. Super excited, obviously, to meet you and discuss all the cool things that we discussed in Phoenix. And so looking forward to chatting with you today.
It's really exciting. And so I want to just jump right in, because people get a little bit confused about nutrigenomics, and they get confused as to where does it fit, because we know it's not diagnostic testing, but we also know that it's going to give us more insight than just your general, health and wellness protocols, even if that's like get good quality sleep, reduce your stress, eat fruits and vegetables, where does this fit in your research and your opinion?
Yeah, absolutely. Yeah. So I think you bring up a great point. The concept of nutrigenomics and that science has existed for quite a while now. I think the understanding of the application of nutrigenomics has started to become a lot more functional in nature, and that's kind of what we do as a company, is where we're very functional in the approach that we take to nutrigenomics. Whereas before it was really about, oh, you've got this one gene and you've got this version, that means you shouldn't eat this. And that was a very kind of siloed or individualistic approach, right? So, oh, you metabolize fats very, very well, you should consider being on a ketogenic diet. And what we've realized as we've done the research is that you just simply can't look at one gene and make a decision on your health outcomes based on the results of one gene. You really have to look at what's happening upstream, what's happening downstream, what are the implications of this. So nutrigenomics as a practical science to inform a more personalized approach to diet nutrition, absolutely, but in a functional manner versus an individualistic manner. That's the key here, is you really want to make sure you're looking at all the cursory genes that could be impacting your decisions.
I think that's the biggest question right there, right? Because that's the, it's not just if this, then that. It's if this and this and this and this, then that.
Yeah, I mean, I think just days ago we were doing some research and we came across some fascinating data that showed that for some males, going on the ketogenic diet can result in an increased risk of erectile dysfunction, loss of libido, low testosterone levels. And just like, wow, like, how is that possible? And then when you look at the genetics that form or inform your decision making when it comes to whether or not you should be on ketogenic diet, you have to look at your metabolism of fats, your insulin resistance, and then the impact of elevated blood sugars on blood flow, on hormone production. So it's no longer, oh, let me just do a quick test and figure out which diet I should be on. It's like, hold on a second, you're an individual. So your approach to your diet should be individual. It shouldn't be a one size fits all or what some guy on Google or Instagram told you to do. You really have to be very careful with your approach to diet nutrition. And we specialize in that on the nutrigenomics aspect.
We basically just had two contradicting things in my mind, because you just said, like, it can't be so individualistic. Like, it can't just be like you have BDNF, so therefore do this. It has to be a little bit more like, all right, you have the clump of genes that are then putting you in this sort of category. But at the same time, you're saying, your diet needs to just be, it's not just like, okay, your doctor likes a keto diet, your doctor likes a vegan diet, your doctor likes, the Mediterranean diet. It should be a bit more real, like individualistic. So those are kind of two different things, but
yeah. And what we're trying to say is don't look at one gene and make a decision on your whole diet from the result of one gene. Look at all the genes that impact diet and then build that individualized plan based on the results of all of those genes, right? I can't just look at, okay, I metabolize fats really well, I'm going to jump into keto. How do I metabolize carbs? What does my insulin response look like? What do my BDNF levels look like? What does my psychology look like? You got so many people, they're like, I want you to eat chicken and broccoli for 7 days straight. And they'll do it for 5 days. And then they'll get into a fight with their partner. And then they'll just eat a tub of ice cream for the next 3 days. That's a psychology of eating that we haven't even addressed yet. And when you study someone and you try to build a plan for them, you have to build that into their plan to know that, hey, if they come under stress, they may want to break their diet habits. So how do we structure something to help manage that situation? Because no matter how healthy you are, when you have a bad day, sometimes you just want to eat a tub of ice cream, right? So how do you manage that? Those are some of the insights that we can provide people.
We all do want to eat a tub of ice cream. So I mean, we're just a couple minutes in and you've already brought up sex and eating a tub of ice cream. So I mean, I get it. This is totally marketable to so many different people. But I mean, in the research that I've done and when I've worked with nutrigenomics in health programs, I really found that it was helpful in behavior change in that way. But can you walk me through that a little bit? Why you think nutrigenomic testing is such a beneficial layer to like oh my gosh, that's the holy grail of health and wellness, isn't it? Is getting people to make, it's not just take this pill, it's make the lifestyle change, make the behavior changes.
Yeah, and you bring up such an important point. When you talk to most people and when they go, when they're getting general health advice, the top four things everyone gets told is you need to eat better, you need to work out more, you need to sleep better, and you need to stress less. I could have gone to Google to find that out. I didn't have to go to a doctor or do anything. So how do I go beyond those four obvious things? And remember, when you tell someone, oh, you need to eat better and you need to work out more, what you're describing is a lifestyle change that's like level 10. People who have been, for example, who are 30 or 40 years old and have never done that to their life, they can't be expected to make those changes overnight. So one of the approaches we employ, to your point, is the behavioral change ideologies, specifically that tiny habit ideology that was popularized by Dr. BJ Fogg, who worked with us on our own genomic reports to create these tiny habit changes in people that will eventually lead to lifestyle changes, right? So one is the philosophy. We tell people you're not on a diet, because diet insinuates a temporary mechanism. Oh, I'm on a diet for a specific period of time. But if you want to make a lifestyle change, you are a person, for example, who only eats between 12 and 8 p.m. versus you're on an intermittent fasting diet. You see how there's a difference? That one is like I'm on a diet for a period of time versus one is, no, this is who I am. I don't eat outside of 12 to 8 p.m. That's my like long-term change, right? But how do you get there? Well, you have to start at level 0 before you can do level 10. And so, for example, if we want to tell people you need to eat more citrus fruit to improve vitamin C, your access to vitamin C, we're going to start by telling them, for a week, I'd like you to place an orange on your bedside table. So when you wake up in the morning, you see the orange and you remember to eat it. On week 2, I want you to cut it at night and put it there so that when you wake up in the morning, you eat it. And then you sort of build them to this point where they're like, citrus is a daily part of my life. I have an orange every day in the morning because I built that habit over weeks, and that's okay, right? People have this weird idea that, oh, there's an end goal, there's like a goal post that I need to reach. And they keep setting these abnormally difficult goalposts that they're trying to reach, so they never get there. And that's a self-defeating psychology that we want to get rid of. Like, there's no goalposts. This is who you are. And so you just keep doing this for the rest of your life, and you're going to extend your health span.
Harris, I recently took my kids to Colorado. We went to Colorado Springs and the zoo there, and it's one of the best zoos in the country. So I know you travel even more than I do. So if you're in Colorado Springs area, take your kids. But when we walked around and we saw the elephants and the monkeys and you're reading about all the animals and you're reading about their diets. And so I always tell people, it's like, well, that's the diet of a gorilla, and that's the diet of a monkey, and that's the diet of the giraffes. Like, we actually got to feed the giraffes. It's an incredible experience. You just like buy the lettuce for $3 a head and you can feed them. It's an amazing zoo. I'm raving about it. But that's what I've always said is like, what is your diet? You are Harris Khan, the animal. Like, what are you eating and how are you living? Are you nocturnal? Are you, I mean, what is it for you? So that was my just 2 cents and recommendation for the zoo. So, but I think the big thing that people, and even providers and patients more so, but providers also. So this is like a softball question for you, is just how is it different than the consumer tests, the ones that we see the Black Friday deals for, the ones that inundate my YouTube ads? How is it different?
Yeah. So, in the world of DNA testing, you have the two extremes. You've got diagnostic testing, where we're trying to test for a specific disease related to mutation. And then on the other end, you have the consumer-based tests that are looking at ancestry, and perhaps there's some health data in there. The approach we take, as I mentioned, is functional in nature. And so what that means is we're not just looking at one gene. We're not just looking at 4 genes. We're looking at this gene's function in a specific system. So the reality is, most people out there aren't really concerned with the version of the gene they have. What they're trying to figure out is there a reason for the outcome I'm experiencing? And that health outcome can be anything. It could be fibromyalgia. It could be weight loss. It could be unable to gain muscle. It could be, cancer in some cases. It could be all sorts of different things. So our goal is to help you understand how one of the potential contributing factors to the health outcome you're experiencing is genomics. And the variations within your genes inform instructions to your body. And then whatever decisions you're making, lifestyle, diet, environment, which are epigenetic factors, quote unquote, but also epistatic factors. Now, epigenetics, everyone knows, right? It's like, what are the non-genetic factors that are affecting gene expression? Epistasis, which not a lot of people know, is how different genes in your DNA can actually impact the variations within other genes, right? So we look at that entire functional approach. And what this allows us to do is create a predictive model, ultimately, for reducing your risk associated with chronic disease. Because here's the big thing. 3 out of every $4 in the US healthcare system is spent on chronic disease, right? And like cardiovascular health, diabetes, Alzheimer's, cancer. But you don't know the first time plaque gets deposited in your arteries. You have no idea. There's no alarm bell going off. You don't know the first time your blood sugars are elevated. And quite often, people don't realize that until they go to the doctor, they do their blood test and they're above that threshold. But by then it's too late. That's years and years of abuse to your body. The functional genomics approach we have helps us predict whether or not you're at increased risk for some of these chronic conditions. And the earlier you know about it, the longer you have to make lifestyle decisions, diet decisions, environmental decisions that are going to reduce that risk and ultimately protect you and extend your health span. Nobody wants to live to 90 and spend the last 30 years in a nursing home. That's not what people want. Everyone wants to live to 90 and they're climbing Mount Kilimanjaro or they're diving into the ocean. Like, you want to extend your health span, not just your lifespan. So when you look at something, what's more objective and more personalized than your DNA, when you peer inside your DNA, you understand your specific predispositions. Now you're scheduling your life, your diet, your nutrition, your environment, your relationships. You're scheduling everything to make sure you're optimizing the genomic code that you carry, not what anyone else carries, right? So our approach is very functional and preventative in nature. And I think that's where we differentiate ourselves from a consumer test or even from these diagnostic mutation-based tests. That's not us. We're not trying to find, diagnostic mutations. We're trying to help you create a model that's ultimately going to extend your health span.
I agree with you too, Harris. I think that some of those tests were like the Snuggie of Christmas gifts, right? The one that that was cool when you opened it, and then who knows where it is now and if it even made it, and just cluttering up information. And a lot of those too aren't really helpful because your PCP doesn't even know how to read it. If you were to bring it in, they don't know how to apply it. And so you either have to partner with a provider who does know how to do it, or partner with you, which is, super affordable. We'll get into a little bit more about how you partner with both individuals and providers. But I think that is just such a great option, and makes it so different. But, biohackers go nuts for this, the slight edge that's going to make them different. And, I put myself in that boat. I wear an Oura ring. My husband wears a Whoop, or will this little extra dose of melatonin increase our REM cycle 5% better? So, our recovery is there. But, some providers, even my dad, who's a provider, he's a women's health primary care provider. He says to us a lot of times, we're too in the weeds. That's what he says, where we do things to optimize our genetic potential. I have my kids, I know what their genetic potential is, and if they got the best of what we gave them or not. And I just put $1 in the therapy fund every single week. That's all I have to say, is I know we're going to screw them up one way or another. So, but where is precision nutrition headed? And is it really, Harris, for everyone?
Yeah, I think the comment that sometimes biohackers do get a little bit too in the weeds is correct to an extent, because what happens is you kind of dive in and then it's hard to see the big picture, right? And what we're about is personalization, but through the big picture. That what that means is, rather than try to hone in and I'm going to fix my sleep and I'm going to take this and this to fix my sleep, let's try to step back 1 foot and see what is the root cause of my sleep issues, right? So for example, you mentioned taking melatonin to get more REM. Melatonin can improve your ability to fall asleep, but what if the root cause of your sleep issues isn't necessarily related to sleep cycles, but there's a stress situation, there's a stressful situation happening, or there's an indigestion situation happening, or there's a microbiome dysfunction situation happening? What we want to help biohackers do using precision nutrition is be a lot more focused on addressing the root cause of their health concerns. And quite often, addressing one root cause solves a lot of problems that they would otherwise be trying to jump in and fix one by one. Do you know what I mean? Like if I, for example, address the genetics of your detoxification, I'm going to solve multiple issues. I'm going to solve, someone's eczema. I'm going to solve someone's autoimmune conditions. I'm going to solve someone's sleep problems. I'm going to solve someone's rest and recovery profile if they're an athlete. So by addressing that root cause, I've fixed a lot of things, probably saved people a ton of money that they didn't, that they were otherwise going to blow on maybe a supplement or some sort of crazy thing. I've helped them save their money and be a lot more focused and get to the results that they want a lot faster, simply by that precision nutrition outlook, that precision nutrition technique, looking at their genes, focusing on that root cause, and ultimately implementing outcomes or implementing strategies that can improve those outcomes.
Yeah. And I think then for your, Gen Pop, person, that also, if you can do that, and then they see that the small tweaks that they're making are having impact in multiple categories of their health, well-being, lifestyle, again, they're gonna get those dopamine firing on all cylinders and everyone's happy, right?
Yeah, I mean, here, look, anyone who's listening right now, I'll give you one super simple hack that a lot of people don't realize that is going to significantly improve a lot of their health. A lot of people take vitamin D, and actually a lot of people don't take vitamin D when they should. But when they start taking vitamin D, they take these huge doses, like 5, 6, 10,000 IU at one time. And in a significant percentage of the population, your body, based on genetics, can't actually transport vitamin D to the area of action as effectively as others. Think of it like a bus. So if you take 5,000 people, show up at a bus stop, but your bus only has space for 2,500, well, 2,500 will get where they need to go. The other 2,500, here's a second misconception. You don't pee out vitamin D, because vitamin D is not water soluble, it's fat soluble. And so you actually store that vitamin D, and over time that can lead to vitamin D toxicity, where you think you have enough vitamin D, but you're not actually storing, you're not actually using it, right? So the simplest thing we tell people is, if you're going to take high doses of vitamin D, split your dose, take it in the morning and take it again in the afternoon, so your body actually uses the vitamin D that you're taking, right? There's a lot of primary care practitioners who will give 50,000 IU a week. For some people that might work, but for many people, that's not only unhealthy, or that's not only not helpful, it can actually be unhealthy for people. So these little tweaks can bring about huge changes in a very short period of time that you can actually like experientially feel like, holy crap, I did that for a week and I feel a ton better just by making that one tweak.
Try to get people to remember to brush their teeth twice a day, though, Harris. No, I mean, that's also, where those behavioral changes. I mean, that's my other question too, because I think that, you guys make nutrient recommendations. That's a big part, and that's a big part of what you've even done through former work. You've been doing this for years now. Mm-hmm. And in my opinion, I think that this is really how providers can wrap a whole program around nutrigenomic testing, because there is that follow-up. There's that, behavior change, the health coach aspect of it. And you have such great tips, whether it was the orange on your bedside, breaking things up. I think, you've really put this into the DNA company and into the mission of what you're doing with your company. But how quickly, I mean, are you incorporating advancements in the science and literature? Like, it's bouncing around, right? So, I mean, we could know this today, and then tomorrow we could learn something new about vitamin D, or something new about the other genes that are impacted around vitamin D. Just seems like it's like space exploration. It's never going to end.
Yeah, I mean, and you know what? So our mandate internally is we're constantly in R&D mode, like constantly going through research articles, constantly trying to tie things together through our insights, existing insights, speaking with, world-class clinicians, world-class clinical scientists, putting data together, studying the outcomes of that data. So I liken it to kind of like software updates, right? So you get your phone and you're getting software updates all the time. Doesn't mean that the experience you're having now is any less. It's just they're going to keep improving. Like, we're going to get better and better and better and better. And the quicker you know about it, the more precision-based you can make your decisions, right? Someone getting their test today versus 5 years from now, that person who's doing it 5 years from now, quote unquote, may have access to more knowledge, but they lost out on 5 years where they had an opportunity to improve their health, right? So absolutely, you should get it done today and then let the science come in. And now you've got access to your genes, you're learning all this new information. And the great thing about what we do is we don't overwhelm people with our knowledge. Like there's a lot that we know, but we give it to people in a very consumable and easy to understand manner, both to our patients and our clients and to our practitioner partners, like our clinical partners. We don't overwhelm them either, because as a clinical partner, you know, if you've been practicing for years, you don't want to now become a PhD in genetics. You need to know how the genetics is going to influence patient outcomes. And if we can help you improve those patient outcomes very quickly, then we're doing a good job. So to your point, you know, when we recommend things for practitioners to tell their patients, we're letting them know, listen, the patient, when he comes in, they have to understand that this is a long-term investment. There's a work in progress. There's going to be a lot of back and forth. There's going to be a lot of tweaking. We're going to learn about you just as much as you're going to learn about yourself. And we're going to build a program that you can repeat, right? And become sustainable over time, so that you need less and less and less involvement as you move on, because you figured out a system that works for you. So that's our main goal with the behavioral change aspect of the program.
Tell me a little bit about some success stories with practices that have been using the DNA company.
Well, let's see. So there is, I mean, I could go on, and there's a ton. Really, one of the great things we've been able to do is help practitioners identify how to use genomics based on their specialty. So sometimes there's BHRT practitioners who use a lot of hormone replacement therapy. Sometimes there's migraine doctors who use, you know, like who work specifically in migraine. So what we help them understand is this is how genetics influences a person's predisposition or risk. And so with one of our patients, or with one of our clinical partners, you know, they were BHRT specialists, and they asked a question from us once. They're like, you know, I noticed that I do a lot of hormone replacement therapy, but in like 25% or 30% of my male population, I give them testosterone and they grow breasts, like male breasts, like gynecomastia. Why does that happen? And we're like, well, let's take a look at their genetic profile. Some males are predisposed to producing high levels of estrogen. And remember that estrogen cannot be made except that it's converted from testosterone. So if your genetic pathway converts a lot of your testosterone into estrogen, and you give that person more testosterone, guess what's going to happen? It's eventually going to become more estrogen. So when he learned that, he was like, holy crap, like this completely changes how I approach testosterone replacement therapy for a huge percentage of my male population, particularly as they get older. And it's not to say, well, they can't have it. It's now that you know what's going to happen, you got to start introducing other things like estrogen modulators, you know, like DIM, I3C, some of these ingredients, natural ingredients that can help stimulate or slow down that conversion and still give that person the benefit of taking the testosterone. So that's one instance. I mean, and that's like I'm giving an example. We've had like probably dozens of practitioners come to that realization looking at the genetics, right? So genetics can really help you personalize and become a lot more intelligent in some of the therapies that you're already implementing as a practitioner.
I found Harris in putting together programs, optimizing programs for different providers who use nutrigenomics. I mean, it also helps just further relationships that providers have with their patients, because that's more touch points. And sometimes your providers that are your favorite providers, it is that customer share, right? It's that patient share. And you know, they're already going to you. They really love and know, like, and trust you. And if you can offer something else, if it's of interest to you. But I mean, Harris, I put together or worked with a program that was already pre-existing, but I helped them optimize and make some tweaks. It was actually a dentist that wanted to do, you know, a little bit more with health and nutrition and weight loss. And they were already seeing a lot of those risk factors. And they just had those like raving fan patients that just said, we want to come, like, we want to hang out and do these group weight loss programs right there in your waiting room and hang out with you and spend more time with you. And the owners were super into health and wellness. So it's sometimes really suspecting providers that really take a hold of this. And I've just seen so much more of that throughout the years. I mean, I think that the great resignation of all industries, healthcare especially, people are just, sick and tired of being sick and tired and saying, what else can I do? What else can I offer? That's across the board. You could make really a whole career of just doing this with people. There's enough there and enough people looking at it. So, and I also think, Harris, that most providers don't have enough time in their day to implement an intensive program, such as reading genomics. That's the first thing. When these reports come back, remind me again, Harris, you have 80 someone. How many genes are in your test?
Yeah, so currently we test about 80 different variations, 60 to 80, so, depending on kind of the focus that we have. And that's across different variations. So it's not just SNPs. Most people know DNA testing to be SNP testing. We test for variations outside of SNPs, CNVs, indels. All of that is to say that we're a lot more functional, a lot more comprehensive in our approach, right? But to your point is, we want to build programs that are largely self-sustainable. And for practitioners, they solve three things. One, practitioners have to feel like they have to spend less time per patient, which they want. They get to make a significant source of income, number two. And then number three, they improve patient health outcomes, which is the most important thing, at a much faster rate. And the patients come back happy, like, hey, you solved my problem because you introduced me to this genetics, and then you taught me how I could do it myself. And now I'm doing a lot of things myself. And I'm just coming here to tell you that I'm doing a great job. And what practitioner doesn't want to hear that, right? So we've done all of that work to help practitioners easily implement this into their system, and then just let it run itself. It's literally, you just plug and play and it runs itself. And if you as a practitioner are just interested and want to learn more and dive into genetics, we even have training programs where you can literally dive into genetics and learn about it and get super into the whole functional genomics space. But we offer that opportunity to whoever wants to dive into it. So we've got a huge kind of a wide gamut of experiential services and products that practitioners can explore.
Yeah. And I mean, that income potential too. I know I was hearing Kasha, who also works with you at the DNA company, and explained just how there was one practitioner, and I think, I don't want to misquote it, but I want to say it was like $100,000 program that he built around the DNA company. Do you remember this? Him talking about this? Yeah.
Because practitioners have the market, right? So they've got people who will, they say jump, they say how high kind of thing. So you can literally build whatever price you want off this product, because at the end of the day, it's your relationship with your patient. Your patient will pay whatever they see value in.
And the outcome that they're going to get. I was just reading, Serena Williams pays one of her coaches, just one, over $1 million, like 1 point something million dollars. I mean, and that's one coach. But if I'm Serena Williams, like, I want to have a coach that's only focusing on me, that I can call anytime, that I can, FaceTime, that I can say, I need help right now. It doesn't matter. And I want you to be able to clear your schedule, so I'm the only one that you help. So, it's also not just like saying, is there a practitioner that have people that say, like, I'm all in, I'll do it. But wouldn't you also rather tell your patients, I can have less patients and focus on you? And that's what I love, like the direct primary care model for that reason, the concierge model for that reason. I love high-end one-to-one coaching for that reason. But what I really like about the DNA company is you guys really are a very comprehensive piece that you can then create an entire framework around that one piece. There's enough information there to then be able to continue to help people. And then, with the nutritional recommendations that you guys make, the behavioral change recommendations, with the additional information that then you can go and see, because it's not just saying, again, this isn't diagnostic. So it doesn't mean just because I have all the predisposition, which I do, I have both a family history and a predisposition to autoimmune disease, but I don't have an autoimmune disease. So, I am living that lifestyle recommendation. I unfortunately don't have that story where I can say I had an autoimmune disease and I didn't know what it was, but my mom did, and my brother did. And so family history, and then to find out the genetic history. So I am super adherent to all the things that my provider went over with me to be able to keep that at bay. So, That's my little success story right
Yeah.
there.
Yeah. And I mean, you've made such a perfect point. Like in the future, there's going to be a lot more focus on that kind of concierge experience. People are just sick and tired, like you said, just, they just don't want to go to a GP and do some blood tests. And he's like, yeah, okay, you're fine. Take a Tylenol if you feel some pain. No, like I want someone who's going to sit there and be personalized and walk me through this journey and get me to where I want to be, right? Everyone wants to be 2.0 version of themselves. Well, the way you're going to do that in an extremely effective, individualistic, personalized manner is if you start from a position of personalization, and there's nothing more objective or personalized than your DNA, right? That's who you are as a person. So if we schedule and we build around your DNA, you're going to reach your patient outcomes, you're going to reach your own goals at a much faster rate, and then you're going to be sustaining them for the rest of your life. So it's a win-win-win for everyone involved.
Awesome. TheDNAcompany.com. Anywhere else you want them to go to hear more from you?
So our patients can, any client who's interested in signing up for our service can go to TheDNAcompany.com. Practitioners have a practitioner site, and that's DNA.clinic. So if they want to become a partner of ours or whatever it is, they can visit there, and they'll see some of our sample reports, clinician cheat sheets, and then they can also sign up to be a partner on that website.
Perfect. Oh, that's awesome. Harris, I appreciate you. Thank you so much. And I really hope people take advantage of the potential of working with you. I think it's a win for everyone.
I hope so as well. Thanks for having me on board, and loved chatting with you this afternoon.
Awesome. Bye, everyone. Thanks so much for listening. And I want to help you have a healthy business inside and out. If you've been trying to market and sell your services and things just aren't clicking for you, then we'd like to help you have a major shift and feel completely confident in how you move people through a health journey. I want to invite you to take advantage of a special free health program discovery session where you'll work together with one of our coaches to create an empowering vision for your health business success. Find hidden barriers that may be limiting your growth. Feel the confidence successful health providers embody in their business, and grab some inspiration for yourself to have a highly converting, highly successful signature health program. Head over to sarahtigender.com/work with Sarah to grab one of our limited spots.